to just bring some awareness and to educate our people to live healthy and to make our nation healthy. If we are healthy, our kids will be healthy and our nation will be healthy. So our guest of honor, MP Sonia Sidhu, who is chair of diabetes committee of House of Commons. She is busy in some other event and she called me. She said that she will be reaching very soon. And today, Alhamdulillah, we have educators from William Hostler Health Center, and very soon we are going to hear them. So first of all, I would like to invite on stage our co-chairman, Mr. Zaki Hassan Saab. Zaki bhai, please come on the stage. And another co-chair, Mr. Riaz Ahmad Saab, please come on the stage. Please. These are our two hands to whose help Unity in the Community is able to organize this seminar. Zaki bhai is our role model. Why, ladies and gentlemen, why he is our role model? Sometimes back, he is going to tell you by himself. He got very high diabetes, around 20, and he got a stroke, and then he was paralyzed and sticking to the bed for 1 year. Then he got a will and he had healthy diets, and by his willpower, now Alhamdulillah, he is able to chair our organization, and he is helping us. So what do you say, Zaki bhai? Please share your, please.
Thank you so much. Ladies and gentlemen, Assalamu alaikum. My name is Zaki Hassan, and I'm very privileged to associate with Brother Fasi Sayyed. I just want to tell you the story of my life and that what happened to me when I had the stroke. And it's true, nothing but the negligence. I cannot blame anybody. It's nothing but myself. I was diagnosed diabetes about 18 years ago, but did not take care of myself. So a few years back, I had a stroke, which is a TIA, I think they call it in medical language. Anybody in the medical side? TIA is one of the function that, so my left hand was totally disabled. I just fell at home, and that time my sugar was 23. So you can imagine that normal is 6 or 7, and mine was 23. And I was a heavy smoker at that time also. Not now, not now. So anyway, I was in the hospital for a couple months, 60 days. That taught me a very lesson, but in a bad way. For 1 year, they took my license, the Ministry of Transportation. So I was totally disabled from that also. And as you know, that I'm a realtor, so I need the car, or I need the driving. Anyway, beside that, my suggestion to the people who have this diabetes is to take care of themselves. Beside that, I think the medication is one of them. Mental ability is another part that we should take care of ourselves. That is very positive thinking, which I learned in the 60 days in the hospital, including the neurology department and as well as the physiotherapy department, that I learned a lot lying down on the bed, staring at the ceiling, that what negligence can do to your body. I was totally disabled on the left-hand side. But alhamdulillah, by grace of Almighty, I'm fine now. Everybody's dua, my mother's dua. I came out of the hospital and stayed home. And it was not easy. It was not easy. So I took my time. I decided myself I will live a healthy life, which is very important to anyone. So diabetes, people who has the diabetes, they should go to their doctor regularly, check their AIC or A1C, I should say. And diet is the control. Exercise is another part which plays a big role in the healthy life. These days, I think it's $9.99 per month. You can go for a payless or a good life exercise. So I think that's one of part is I lost my confidence that within 1 year time But Alhamdulillah, I decided myself that if I'm going to live, I'm going to live healthy. So I took the steps according to the doctor that what I should do and what I should not do it. And Alhamdulillah, now I'm in front of you and doing my work from the last 6, 7 years, as a realtor. Uh, and I'm glad that I met Fasi Bhai for this education program. It's a very learning curve that everyone who are pre-diabetic also, they should take care of it. And I'll come back again, and if the time permits, and I'll give it to Fasi Bhai. Thank you so much for your.
Thank you very much. Thank you, Zakir bhai. So this seminar is being organized with the help of Canadian Association of Pakistani Pharmacists, and some of their representative and secretary, Mr. Riaz Ahmed is here. So I would like to invite Mr. Riaz Ahmed to say a few words.
Good evening to everyone, and thank you, Fasi Bhai. Actually, it's a very good effort. It's a very good effort. Uh, and as a CAP members, we are cooperating with UIC. Our aim is together we can help, we can make the world healthier, and we all working together. And I hope everything will be good. Thank you very much.
Thank you. Our another co-chair, Sama Siddiqui, is here. I would like to request to say a few words. Sama sister, please come.
Assalamu alaikum everyone. Hello, assalamu alaikum. Thank you Fasi भाई, आपने जो अवेयरनेस के लिए कर रहे हैं डायबिटीज़ के लिए, ये बहुत ही अच्छा है कि हमें इन सब चीज़ों के बारे में थोड़ा सा we should know that कि how we like daily routine, we have to like follow the activities, daily exercise, daily food. We have to eat healthy food. This is I heard, I don't know, maybe I'm wrong. This is a third type of cancer. Diabetes 3 is the third type of cancer, right? So we have to like watch what we eat, and what we do, we have to take it out at least half an hour from our day routine to do exercise. Try to be healthy and happy. Thank you for doing
Thank you.
this.
Thank you very much. ये इस तरह के सेमिनार्स कराने का मकसद ये होता है कि जैसे अब हमारे बड़े भाई हैं, असलम भाई भी बैठे हुए हैं, माशाल्लाह से इनकी भी शुगर 18 तक सुना पहुंच गई थी, तो अब इनको कितनी ज़रूरत है एक्सरसाइज की, डाइट की. सिस्टर जैनुल यहाँ पर विलियम हॉस्टलर हेल्थ सेंटर से all the educators are here. They will educate you. And Masab is very learned physiotherapist. He's here. He will train you how to do some exercises at home. And thank you, Nadeem Bhai, for coming here from Pakistan Times. Rizwan Aslam Bhai, thank you very much. Ashfaq Bhai, बहुत बहुत शुक्रिया आपका. आप हमें खून भी देते हैं और आके हमारा हौसला भी बढ़ाते हैं. Thank you very much. Now, Ali Qureshi, please, onward.
Assalamu alaikum, brother and sister, or ladies and gentlemen. So now we'll actually start the program. So we'll start with the William Ulcer organization. First, I'll call Sasha Zuno. She is the registered nurse and certified dietitian educationer. She'll just talk about what diabetes is, what to eat, what not to eat, what are the things you need to watch out if you are having diabetes also, or you are pre-diabetic. She's going to give you a little bit of education about it. Their organization is basically dealing with all the information about the whole diabetes, and it will be very beneficial for you all. Thank you.
Take the other one out. That one's it. Assalamu alaikum. Can everyone hear me okay? Okay. To our non-Muslim brothers and sisters, welcome. And it's such a pleasure to be here today. My name is Shaista. I am a nurse, a certified diabetes educator at William Osler Health System. I am also the coordinator of the Diabetes Outreach Program. So what we do at William Osler, we cater to people who have pre-diabetes, who have type 1 diabetes, type 2 diabetes, gestational diabetes, as well as people who are at risk of diabetes. And some of my colleagues here today will speak to you more about some of the programs that we have, right? The Diabetes Outreach Program at William Osler offers an opportunity for us to access education closer to home. So we aim to eliminate some of the barriers to accessing education. We provide education in the community at various locations, such as community venues. In fact, South Fletcher's, we've done programs here where we do clinical education to patients who have diabetes. Some of our other locations include the soccer center, pharmacies, many pharmacy clinics we've done, also partnering with community physicians to bring education into the doctor's office. Patients of that physician can then simply go to their doctor's office and obtain education from a nurse and dietitian, right? Our education is also culturally relevant and language specific, so we have educators who speak a variety of different languages, Punjabi, Hindi, Urdu, Tamil, Malayalam, the list goes on, Italian, French, and so on. It's not just a language, of course, right? It is about relating to individuals and being able to provide culturally specific education, especially when it comes to diet and lifestyle. Do you agree? Yeah? No? Okay, I've timed out here, so I'm gonna have to hook up again. And I apologize that this is going to be probably a little bit fuzzy. It's the best we could do. Without a screen, it's a little bit distorted, but hopefully you can all see. I would encourage you at the back, if you're having difficulty seeing, to maybe just move up a little bit, move a little bit closer if you're having difficulty seeing. Our presentation today, and my part will be about the management piece. Dharmbir will be speaking about the diet and foods, right? We are talking about diabetes and heart health, right? As I said, there are various types of diabetes. Who can tell me which type of diabetes is the most common? Type 2 diabetes, absolutely. Type 2 diabetes accounts for about 90% of all individuals with diabetes, okay? In our region of Central West, Lynn, which is Brampton and Etobicoke, Woodbridge, Bolton, Caledon, and Malton, we actually have the highest prevalence of diabetes in all of Ontario. So we have a lot of work to do. So I thank Brother Fassi for this initiative and bringing you together to hopefully you can gain some information that you can take away, even if it's one small piece that you are able to take away today that can help you to live a healthier life. That's why we're all here, right? Because we are all concerned and committed to living healthier lives. Okay? So, because diabetes is so prevalent, it really speaks to our lifestyles quite a bit. What is diabetes? Who can tell me what is diabetes? Everybody knows it's high sugar, right? But what else happens? Does anyone know? Sugar, yeah? What's that, sorry? Increase of glucose, yeah. But what happens to that glucose? Do you know why it's high? What causes diabetes? All right. Very good, yes. So diabetes is caused when blood sugars are too high, okay? And sugar can't get into the cells of our body. Do we need sugar? Absolutely. Every single cell in our body needs sugar for energy. So is sugar absolutely bad? No. we do need it. It's how much we need and how we use it, how our body uses it, right? So if we were to consider this room as one cell in our body, and sugar needed to come in here. So this cell is starving for energy. It needs the sugar. It needs the sugar to do its job, to work, to have energy. The sugar's outside the door. Sugar's not able to come in. Okay? How is the sugar going to get into this cell? Who opens the door? So it is actually the insulin, the hormone insulin that our pancreas produces, that little tiny organ in our abdomen that produces insulin that helps to get the sugar through the door into the cells, right? So type 2 diabetes is really about when the pancreas isn't producing insulin enough, or that the insulin that it is producing is not working properly. That in a nutshell is what type 2 diabetes is, right? When those sugars remain in the bloodstream over an extended period of time, that's when we start to see complications develop, right? And today we're talking about one of those major complications, which is heart disease. I don't know how well you can see this. Is it very faint? You can't see in your front row. Sorry about that. Okay. So we already talked about diabetes and what it is, but we can see that the complications of diabetes are many. Heart disease is absolutely one major complication of diabetes. So is kidney disease and damage to the eyes that can lead to retinopathy or blindness. And I heard the brother talk about not being able to drive for a year, right? Also, damage to nerves, to the nervous system, can cause circulatory problems in the feet, can lead to amputation and multiple other problems, right? So it is a serious condition, and I'm sorry, it's faded out at the bottom. This is the best we could do, I'm sorry. But I will speak as much as I can about it. So how do we develop heart disease? Family history is a big one, okay? If one has a family member with diabetes, or sorry, with heart condition, it does predispose us to being more at risk of developing heart disease. Also, diabetes is right up there, okay? Having a family member with heart disease and having diabetes predisposes us to developing heart disease. Additionally, we see high blood pressure right up there, lack of exercise, sedentary lifestyle, and abdominal obesity. So these are all risk factors for the development of heart disease. What we do know is that amongst the complications of diabetes, heart disease is actually the most serious complication of diabetes, unfortunately, okay? And when one has diabetes that is uncontrolled, coronary artery disease does become a major leading factor in mortality for people with diabetes. In fact, people with diabetes are at a 2 times greater risk of developing heart disease compared to people without diabetes, right? A 2 times greater risk. High blood glucose levels together with hypertension and high cholesterol does also increase that risk even further. So cholesterol is one factor that also contributes to the development of heart disease. I'm sure you've all heard of cholesterol. There's good cholesterol and bad cholesterol. I'm going to make this really simple. I'm not going to get into a lot of all of the details because time doesn't allow for it right now. But essentially, cholesterol is a waxy substance that is found in our body. There is HDL cholesterol, which is considered the good cholesterol. I like to call it the happy cholesterol. And there's LDL cholesterol, which is the bad cholesterol. The LDL cholesterol, if it's elevated, that's what usually leads to development of atherosclerosis, clogging of the arteries, which can then increase the risk of developing a stroke and or a heart attack. So the picture here shows how that development occurs. I don't know how well you can see it. And then the next one shows the progression then of atherosclerosis from a normal blood vessel to some buildup of fatty tissue. Then it gradually increases, so now it's about half the size of the lumen. Then to the very end, it's completely occluded, right? And this is where we're going to start to see a stroke or a heart attack occur. Okay. Screening for diabetes should be done once 1 to 3 years. I would say if anyone has a risk factor for diabetes, and I think looking around the room here, we all do, I strongly recommend that we have a blood test done once a year. At least every year when we do our annual physical, we have a blood test done. Okay, if we have got diabetes and high cholesterol, that's exactly the reason why we need to do it more often. The targets for LDL cholesterol should be less than 2. Okay, total cholesterol to the HDL, the good cholesterol ratio, should be below 4. And I'm sorry, I'm going to skip the slide because you're not going to be able to see it. So how can one lower their bad cholesterol? We already established that bad cholesterol, the LDL cholesterol, is what contributes to the buildup of plaque, the atherosclerosis, that can then cause heart attack or stroke. How can we control cholesterol? Right, we can see here 4 key messages: weight management, physical activity, healthy eating, which we'll talk more about in a little bit, and might need some lipid modifying medications as well, right? Well, that's better. Yeah, so better. Okay. So high blood pressure, again, is one of those conditions that is very prevalent in the South Asian community. So we have diabetes, we have cardiovascular disease, we have high blood pressure. We are at a greater risk, right? Unfortunately, our genes, we can't control them. But can we do anything about that? Do we say, well, it's in our genes? Do we just give up? Is there something we can do? Absolutely. That's why we're here, right? We can do what we can by choosing some healthy lifestyle measures, right, to push back those risk factors or even prevent them, hopefully prevent them, right? So high blood pressure is really when blood pressure is when the pressure of is a measure of the pressure of blood against the walls of blood vessels, right? When blood pressure continues to get high, it again puts risk of other conditions, as we talked about. We aim for a blood pressure in a normal person. We aim for a blood pressure of below 140/90. Okay? When one has diabetes, okay. Welcome, Sonia. So, when one has diabetes, we aim for a blood pressure of below 130, okay? Normally, we say anything below 140/90 is good, but for people who have diabetes, we aim for a blood pressure of below 130/80. So hypertension, again, can put strain on the heart, the kidneys, the eyes, as I said, aiming for a blood pressure below 130/80. And also blood pressure, you need to look at this. The causes of hypertension can be atherosclerosis, right, which we talked about earlier, smoking, excessive alcohol consumption, poor exercise management or lack of exercise, and perhaps too much sodium in the diet, or that cholesterol that might be climbing up, right? How can one lower blood pressure? The first point here is really being physically active. And I can't talk enough about the benefits of activity. the list just seems to go on and on, right? But knowing that just a few minutes, 30 minutes of physical activity a day can significantly lower our blood pressure, blood sugar, our bad cholesterol, increase mental health, wellness, and the list goes on, right? So I'm telling you and I'm telling myself as well, because it really is a reminder to us all, even a little bit of walking every day. If we are just starting off and we cannot get to 30 minutes a day, then even as little as 10 minutes a day will make a difference, right? But starting off, making a plan and building up is what's really essential. Lowering salt in our diets, okay? And Dharmbir again will speak more about the diet and some suggestions, hopefully, for you today. Maybe there is a necessity for medication as well, some of the medications to lower blood pressure. If one is smoking, absolutely seriously consider stopping smoking. And again, limiting alcohol intake to less than 2 drinks per day if anyone does smoke. Okay? Again, this is a really busy slide, and because it's a little bit distorted, I'm thinking you might have a hard time seeing it, but I will speak to it. So staying healthy, right? Staying heart healthy with diabetes. The combination is not an easy one, but it is possible again to really make some changes in our lives and again, push back the risk of complication, right? So we want to keep those blood cholesterol levels in a good level. We want to get our cholesterol levels checked every year. We want to consume a diet that is less than 30% of source of daily fat, right? And decreasing the amount of salt, of course, in your diet can help to lower the blood pressure. Regular exercise, I talked about that again, which can also lead to weight management and some weight loss, and can also then result in lower blood pressures, staying away from smoking, and perhaps some medications for cholesterol and diabetes management, of course. Right. There are medications now that are prescribed for blood sugar lowering effects, but have been found now to have the added value of heart protection. And I'm sure that you will hear more about that from your physicians, or if you'd like to speak more about medications, I'm sure our beautiful panel here would love to speak more about that. Okay? Again, this is a really bad slide, but you can come to our table and you can get more information. I do have a handout of this, but it's really the targets. It's the ABCs of diabetes. A stands for, does anybody know what the A stands for of diabetes management? So A stands for A1C. Who can tell me what A1C is? A1C is a test. It is a test. It's done every 3 months. The recommended timeline is to have it done every 3 to 6 months. But can anyone tell me what it tests? I heard it. I heard it somewhere. The average of your blood sugars over the last 3 months. Yes, that is what the A1C is. And we aim to keep that A1C less than 7%. In fact, depending on the other comorbidities or complications that an individual may have, this number is often now customized. So the most recent clinical practice guidelines from Diabetes Canada indicate very much need for customizing the A1C, but in general, overall, we want to aim for an A1C of less than 7. It is good for you to know that, because if it's 7.5 today, and you go to your doctor next 3 months from today, and you see that it's gone up to 8, right? You have to ask yourself, what am I doing? Is there something that I can do to correct that? Or if it's gone down to 6.5, well, something I'm doing is working. Is it the medication? Is it my diet? Have I managed to control my diet? Is it the physical activity? Or is it the combination of that? All of those, right? So it is really valuable for you to know your lab values and keep a record of that, okay? As I said, this is on the table, so please come up and you can grab one. And I'm coming to the end of my presentation right now. So I want to thank you for this opportunity to share some information with you. And I'm going to pass you on to my colleague, who is Darmbeer and a registered dietitian with the William Ozer Diabetes Prevention Program. Thank you.
So it is our honor that a member of parliament, as well as she is the chair of diabetes committee of House of Commons, and since she is busy in some other event, she has to leave as soon as possible. So that's why I'm interrupting this education session. So I would like to request our member of parliament, Ms. Sonia Sidhu, please.
Assalamu alaikum, good evening to everyone. First of all, unity in the community, I want to congratulate you. This is the second annual awareness you're doing. Thank you very much for doing this. You know why? Because South Asian community is the biggest risk, on the biggest risk. And thank you for doing that. As you know, this year, nationally, we can do the awareness month, because I put motion in the House of Commons that got passed unanimously. That is why nationally we can celebrate the awareness nationally on 14th November, the Diabetes Awareness Month. We gave the insulin to the world. Why we cannot lead the way? On the last mandate, I worked hard on that issue. First of all, that was in my mandate. Awareness Month. The second thing, we gave money, more than $15 million to diabetes research. If we can give the money, and then we can do more research. Third thing, we brought pilot project right here in Brampton for diabetes prevention. Now you can go there and get the benefit from there. And the health committee, we worked hard on the national pharmacare. So we need to do a lot more, and it's not like organization's responsibility. Yes, there is, but it's our responsibility as well. As you know, in the last mandate, we changed our food guide. We can make a healthy food choices. Now it's available in Urdu, it's available in any language, 26 languages. So you can make your healthy choices. Second thing, if we live active, and we can even though delay onset diabetes. So let's defeat diabetes together. As you know, this is in November. It's not just 1 month. It's go hand in hand. Eating healthy, active lifestyle, and if somebody has a diabetes, please take medication regularly and do checkup, because it's cause of so many, like kidney disease, heart disease, blindness. As you know, William Osler's people are already talking to you about that. It can cause serious consequences, which you don't want. So let's work together to defeat diabetes. And thank you very much, unity in the community. I know you have a clothing drive. You have done lots of things, but we need to do a lot more. And I'm always here to support you. Thank you very much for inviting me. On behalf of our government, I really want to congratulate you. On behalf of my colleagues too. We work hard. 5 members, 5 MPs, we're working in a team, and that is why. And then, as I said, it's everyone's responsibility to live an active lifestyle, to eat healthy choices, and teach your kids how to cook at home. And this is very, very important. Thank you very much again for inviting me. And keep it up.
Thank you so much, Sonia Sadhu, for coming here and blessing this event. I know that you have other engagement as well, but again, it's a good reminder from you that we should start teaching our kids to eat healthy and cook healthy, I guess. So thank you so much. So again, we're going to move on to our program with the from William Osler. So I'd like to call Dhramveer Man. She is the registered dietitian and certified diabetes educationer, and she's going to talk about diabetes program and prevention. Thank you so much.
Hello everyone, Assalamu alaikum. And my name is Dharamveer. I'm a dietitian and certified diabetes educator. Can you hear me? No? Okay, I'll speak loud now. So hi everyone, can you see this? Okay, so let's talk about heart healthy eating in diabetes. How can we reduce the risk of heart disease with diabetes? First of all, we want to control blood sugar levels, and I'll show you a plate method. And other one is we'll learn about some fats and their effect on cholesterol, some benefits of fiber, and limit salt intake to prevent hypertension. So as you can see this plate, half of the plate is vegetables. You can choose different kind of vegetables. For example, if you made some okra, okra is also called bhindi, and bhindi ki sabzi, and on the other side you can have some lettuce or cucumber salad. So there is two different vegetables. Half of the plate is vegetables. Rest of the half is divided into grains and starches and meat and alternatives. So under grains and starches come your roti, naan, rice, pasta, potato, corn. So that's the part. And also the recommendation is try to choose whole grains. Benefits of whole grains are there is more fiber in it, there is more B vitamins, and also it will make you feel full for longer. And other half on this, 1/4 of your plate is meat and alternatives. You can choose fish, lean meats, lentils, beans, and it's a good idea to cook beans and lentils with less fat and salt. And you can include a medium fruit and low-fat dairy. So how many of you, you think you are eating like using plate method? Do you think your plate is half full with vegetables? So I think this is a good starting point. Next one is fat. What is fat? It's very important nutrient. It's a source of energy. It adds texture and taste to your food, makes you feel full longer, and also a source of all the fat-soluble vitamins like vitamin A, D, E, and K. The key is to use fat in small amounts, and we will know what are different types of fats in next slide. So where is this fat found? Fat is easy to see. For example, butter, margarine, you can see it's fat. Oil is fat. Fat on outside of the skin, on the chicken, like you can see there is fat. And also you can see marbling on meat, like piece of steak. There is some white stuff on it. That is fat. And also fat is present in, hidden, like it's present in some snacks, some baked goods, fried foods, cream soups, etc. Fat is different types. There is mono unsaturated fats, polyunsaturated fats, saturated fat, and trans fats. So let's talk about mono unsaturated fats. These are considered good fats because they help decrease the bad cholesterol. Some examples are olive oil, canola oil, margarine made with canola, peanuts, nuts, and avocado. Other one is polyunsaturated fats. There are two main types. You might have heard about omega-3s. Sources of flaxseed, like their sources are flaxseed, walnuts, canola oil, soybean, cold water fish. Some sources of omega-6 are flaxseed, walnuts, canola, soybean, and cold water fish. So this is a main one, saturated fats. Diet high in saturated fats actually increases bad cholesterol. So that's why we have to limit saturated fats. Like they are mostly solid at room temperatures. Butter, cake, pastries, chocolate bars, coconut milk, palm oil, and high-fat dairy products are some of the examples. Trans fat is actually banned in Canada right now. I think last year it was banned. So what it does is it increases bad cholesterol and decreases good cholesterol. You can see the label. If it says 0, then only then buy the product, otherwise don't. Mostly found in commercially prepared foods like donuts, cookies, crackers, cereals, shortenings, etc. And next one is we can control diabetes by increasing fiber in diet. According to clinical practice guidelines, 25 to 50 gram fiber is required, is recommended. So why fiber? What fiber does is fiber is something your body cannot digest. It helps with bowel regularity, prevent constipation. It helps controlling blood cholesterol. It helps controlling blood sugar levels. It makes you feel full. Some good sources of soluble fiber also help reduce LDL, which is a bad cholesterol. So where you can get all soluble fiber? In oat bran, barley, nuts, seeds, lentils, fruits, and vegetables. So now you might ask, okay, what should I do to maintain my cholesterol levels? So actually, you know what, if you do all those things, if you are eating by using plate method, and you know, if you're including whole grains, this is the most effective way to control your cholesterol. So it's not the cholesterol, it's the total, like, it's the total fat content, how much saturated and trans fat you're eating, that's gonna affect your cholesterol ultimately. Salt intake and hypertension, another thing we can do is to limit salt to prevent high blood pressure and manage high blood pressure. So too much salt can increase the risk of heart disease. For healthy adults, recommendation is 2300 milligrams a day, which is about a teaspoon. High blood pressure people, like if you already have high blood pressure or kidney disease or diabetes, recommendation is even less. It's 1500 milligrams. But average person consumes about 3500 milligrams of salt a day. So let's take a look where the salt is coming from. In this picture, it says 5% we add in cooking, 6% while eating, 12% from natural sources, and 77% is coming from processed and prepared foods. 77%. Why? Because salt is used as a preservative and also it's a flavor enhancer. So if you see frozen meals, tomato sauce, soup, condiments, canned food items, already prepared food, that will contain more salt. I don't know if you see this picture very clearly, but this is just one example. How you will know if this product contain more salt or less salt, you can always read the label. On the label it says, on this one it says 850 milligrams. It's 35% daily value, which is high. So what we can do is just remember the rule of 5. So less than 5% daily value for sodium. So what can we do to reduce salt in our diet? Buy fresh, plain or canned, no added salt vegetables. You can always rinse if you're buying anything canned. Use fresh poultry, lean meats and fish. Use herbs and spices without any salt. And you can always choose food low in salt. Read the label and choose food those low in salt. If you're buying canned chickpeas or anything canned, you rinse the food very well. So by choosing a variety of fresh fruits and vegetables, high fiber whole grains, low fat dairy, low fat cheese, lean meats, fatty fish and plant proteins, you can actually eat healthy and prevent heart disease. So at the end, I'm just going to say that choose your fats wisely, use vegetable oil, small amount, because we don't need much, and also reduce the amount of salt. That's all. Is there any questions? Sorry? Sorry. Salt is salt. And our body doesn't really need much salt. Like, 1/4 of a teaspoon is sufficient enough for us. I know recommendation is 2300 milligrams, but they keep in mind a lot of things. But we really don't need that much salt. And best thing you can do is read the label. So see, when I showed you the plate method, there is low-fat dairy is included in that. So in the plate method, half a plate is vegetable and rest of the half is divided into carbohydrates, grains and starches and meat and alternatives. There is also low-fat dairy, yes. So coconut oil, olive oil is mono, I think slide was not very clear, but olive oil is high in monounsaturated fatty acids, so which is good for your heart. But coconut oil is mostly saturated fat, so it doesn't. Sorry? There are lots of. For ketogenic diet, that's a whole different complex topic. Yeah, we need a whole another session for that. हाँ. ओके सो अगर हम होल ग्रेन आटा लेते हैं तो उसका होल ग्रेन आटे में फाइबर काफ़ी ज़्यादा होता है राइट कई बार 5-6 डिपेंडिंग ऑन द ब्रांड नेम राइट सो उसका 1 कप आटे की 5 या 6 रोटियां बनाएं 1 कप आटे की 5-6 रोटियां उसको दो एक टाइम पे खानी है सो अगर रोटी खा रहे हो तो चावल नहीं खाने चावल खा रहे हो तो रोटी नहीं खानी क्योंकि चावल रोटी ये वही ग्रेन्स एंड स्टार्च की कैटेगरी में आ जाते हैं अगर खाने हैं दोनों तो उसका अमाउंट देख लो अगर एक रोटी खा रहे हो तो उस हिसाब से चावल एडजस्ट कर लो मोस्टली होता हाँ that's a good one and also vegetables as much as you can hold in your 2 hands fat is only the tip of your thumb sorry oh that's another whole different topic it's very clinical so you need yeah so as Shaista mentioned कि diabetes complications में kidney की भी आ जाती है right kidney पे भी वो असर पड़ता है heart पे भी असर पड़ता है so for that you need to see someone special like maybe go you can book an appointment with the dietitian she will tell you foods to avoid to address that issue so, okay So for when we talk about diabetes, we just tell them to choose lean meats. Lean meat की उस पे से फैट ट्रिम कर दो अगर ग्राउंड भी चिकन को या किसी चीज़ को कुक कर रहे हो तो उसको लेट इट ड्रेन फर्स्ट आफ्टर कुकिंग ताकि उससे फैट ड्रिप हो जाए I mean there is that's another topic मगर हम we do say the lean meats beans, lentils, that comes under protein for diabetes. So basic rule of thumb है कि जैसे वो प्लेट का मेथड है ना वही रखो जैसे आपकी वो जो थाली है उसमें आधी सब्जियां होनी चाहिए चाहे कुक्ड हो चाहे रॉ हो किसी भी तरह की हो अगर एंड जो चौथा हिस्सा है उसमें आप अपना राइस या रोटी रख सकते हो एंड इधर 1/4 में दाल या चिकन या कुछ फिश रख सकते हो दैट्स द मेन थिंग यू हैव टू कीप इन माइंड everything in moderation right particular age to koi is there any particular age for diabetes Shaista can answer that Shaista is going to answer that
You know, it's a really good question because we used to say diabetes, type 2 diabetes, is usually diagnosed after age 40. The sad thing now is that we're seeing teenagers get diagnosed with type 2 diabetes. So it's really changed, and that's because our lifestyles have changed. Oh, if you pass 60 and you don't have diabetes, you're okay? Is that what you're saying? You can develop it at any age, right? Yeah. Yes. Thank you. Sure. And that's a really, really good question. And so we didn't go into a lot of the basic stuff of diabetes because our topic today was diabetes and heart health. But I'm really glad you asked because it is really important that everyone knows what the signs and symptoms of diabetes is, especially if we're not going to the doctor often, right? And again, I want to stress over and over the importance of going to the doctor, getting your annual physical, getting your blood sugar done. Okay, if you are not and you're starting to feel things like excessive thirst, okay, just drinking all the time, wanting to go to the bathroom all the time, right? You might think I'm just drinking a lot, so I'm going to go to the bathroom a lot, right? You might explain it that way, but in fact, it's your body flushing, trying to flush out the excess sugars. Okay, you might be extremely hungry and tiredness. Okay, some people will develop blurred vision. Or you might have a cut. Let's say we get a paper cut and it's gone in a day or so. That may take longer to heal, okay? Especially if it's a cut on the foot, which is furthest away from our heart. And we know our sugars are high. So if our foot gets a cut and it's taking a long time to heal, that is unfortunately one of those big signs of diabetes. I'll tell you a little story, and I don't know how much time we have. I won't take very long. I have a patient who is 45, a professional gentleman, and he recently got diagnosed with diabetes. He ended up in emergency with a foot ulcer. So he'd been busy at work, and you know, he had this sore on his foot, didn't go away. He kept ignoring it, didn't go away, kept getting worse and worse and worse until he had to end up going to emergency, right? When he ended up in emergency, he was diagnosed with type 2 diabetes. He ended up getting a partial amputation, unfortunately. That's how he got diagnosed with diabetes. So unfortunately, sometimes we don't have those symptoms that I just talked about. It can be that silent killer, right? You can be living with high blood sugars and not know it. You may not, or you might explain it away. You may say, I'm thirsty, it's dry, I'm hot, and I'm just drinking a lot, right? And then you pass it out. So it's really, really easy to ignore their symptoms. Sometimes you might not have them until a complication of diabetes arises. My own brother, who lives here, ended up in emergency with a blood sugar of 60. And 60 is extremely high. He came to my house and he was drinking copious amounts. I didn't get to test his blood sugar, and I can kick myself for that because I could have tested his blood sugar. I didn't get to test it. I would have been able to help him sooner. But Allahu Alam, he knows, you know, what's best, right? All right? Thank you. Yes.
For example, okay.
इसके बाद करते हैं हम लोग नमाज का वक्फा हमें करना है क्योंकि अजान हो चुकी है, लोगों ने नमाज पढ़नी है, तो 10 मिनट्स का हम ब्रेक ले रहे हैं. अच्छा, क्वेश्चन आंसर्स के लिए मैं ये बता दूं कि यहाँ पर 2 टेबल्स आप देख रहे हैं, एक विस्लम हॉस्लर की और एक वो CAPP की. उनके पास कुछ एपरेटस भी हैं जो डिस्प्ले करेंगे. आपको कोई भी सवाल हो यहाँ पर आप उनसे दोनों टेबल से, यानी उसके बाद जब हमारा प्रोग्राम ख़त्म हो, क्योंकि हमें 6 बजे हॉल भी खाली करना, दूसरा कोई प्रोग्राम है. यहाँ मैं अरशद भट्टी साहब को भी देख रहा हूँ. थैंक यू वेरी मच अरशद भट्टी साहब फॉर कमिंग हियर. और अपने अली डोगर साहब और उवैस भाई यहाँ पे तशरीफ़ लाएँ, फ़रा यहाँ तशरीफ़ लाएँ. थैंक यू वेरी मच अली. मैं वक्फा कर देता हूँ, उसके बाद आप सवाल पूछ लीजिएगा, ठीक है? तो आप लोग नमाज के लिए पीछे तशरीफ़ ले जाएं, तो नमाज के बाद हम दोबारा शुरू करेंगे. यहाँ मसहब भी बैठे हुए हैं जो आपको एक्सरसाइज करना भी सिखाएंगे अभी इसके बाद.
To just take their seats that we can just continue with the program. If you have already prayed the salah, then we can start the program. आप लोगों से दरखास्त है कि जो नमाज पढ़ चुके हैं पीछे वो आके अपनी सीटों पे आ जाए प्लीज. Thank you very much. So we'll just continue our program. The next guest is again from William Osler. She is Jenna Belden Duke. I hope I pronounced it correctly. So she is the program admin for kinesiologists, Central West Self-Management Program. She's going to give us a small talk on the diabetes as well. So please come.
Can you hear me okay at the back? Do I need to speak up? Can everyone hear me okay? Yes? Okay, perfect. So I am from William Osler as well. I'm from the Central West Self-Management Program. So we kind of just got some tips and tricks on healthy eating and tips on how to live well with heart conditions and diabetes. And that's the main focus of our program, the self-management program. So you might be asking, what is self-management? So I actually have a definition up here to give you a little bit more of a background on that. So self-management is basically what you can do on a day-to-day basis to live well with your chronic health condition. So we had some tips on how to eat healthy. There's also tips on physical activity as well, because essentially you are responsible for maintaining that, and we're here to help you with that with our various programs. So yeah, that being said, self-management, we're going to kind of go into some of the programs we have as well. We are also funded by the Ministry of Health and Long-Term Care as well. So all of our programs are free of cost, and we do our best to bring it out in the community in places that are accessible. We actually do run some out of here at South Fletcher's, Chris Gibson, and other locations as well. So we do serve the Central West Lynn region as well. We are quite Brampton-centric. We are based out of the Peel Memorial Centre Hospital. That's with William Osler. It is part of a provincial strategy as well. And our main focus is prevention and management of chronic health conditions. And the main goal of our program, which it may not be easy to see up here, but it's to support a person-centered approach to care with evidence-based self-management support training for health service providers and programs for people living with or at risk for chronic health conditions. And we also have programs for caregivers as well, because caregiver burnout is so prevalent. And I'll speak to some programs on that as well. So as I mentioned, we do serve the Central West Lynn, mostly Brampton. We also serve Caledon, Malton, Rexdale, Woodbridge, and Dufferin County, so Shelburne and Orangeville as well, if you know anyone that happens to live in those areas as well. So I'm going to speak to some of our community workshops that we offer. As I mentioned, we do bring them out into the community, so we have people contact us on an individual basis and let us know that they're interested in the programs. We put them onto a wait list. We get the location as far as if you're in North Brampton, Central Brampton, South Brampton, your availability as well. We really try to tailor make it to our local community members so that we can make it accessible and at a time that everyone can attend to, because it is such a great program to have. And we also provide resources too, so it is quite helpful. And they're also peer-led by individuals who are either caregiving for someone living with a chronic health condition or living with chronic health conditions themselves. And they are more of a small support style environment in those workshops too. And on a week-to-week basis, you can kind of talk about things that you're experiencing. The main focus is action planning as well. So you can kind of talk to other people in their action planning journeys and kind of see what's working for them, and then it's kind of a support system that way too. So we do have a few diabetes-focused community workshops I'm going to highlight as well, since that's the main topic for today. So we have our Living a Healthy Life series. So these are 6-week workshops. They are 2.5 hours that run once a week for 6 weeks. We do offer them in a number of languages because we have such a diverse population in Brampton and all of the other areas we serve. And it was founded and developed by Stanford University as well, in case anyone was interested. And we do invite caregivers and family members to attend these programs as well, just so they have some additional resources. So there are 3 different Living a Healthy Life workshops we offer. One is diabetes specific. One is for chronic conditions, because we acknowledge some people may be living with more than one condition. And we have one for chronic pain as well. So with these workshops, we do provide free resources as well. So for our diabetes and chronic conditions workshop, everyone gets a book as such. And it goes into things on healthy eating, action planning, physical activity, as simple as doing them on your couch at home. And it also goes into emotions, relaxation, and the mindfulness side of it as well. And then we have a book specifically for chronic pain with the same idea, with exercising, nutrition tips, and relaxation techniques as well. So again, these are all funded by the Ministry of Health, so there's no cost for the resources or to attend any of these programs that I've mentioned. The other diabetes-focused workshop we have is a one-time 2-hour workshop. It's called our Pep Talk, Diabetes, Healthy Feet, and You. It focuses on healthy foot self-care techniques, and everyone also gets a resource as well. So they get a book highlighting the presentation, and they go into some case studies and examples on how to better take care of your feet. They do an activity to make sure you're wearing the right size shoe for your feet, because some people may go for the look of the shoe versus the comfort when it may be doing more harm than good. So it's just a bit of a check-in. And then everyone goes home with a mirror so that they can check their feet every day, and we provide that to them as well. Again, free of cost, and there's no cost for the resources as well. So we do have some other community workshop as well I'll briefly touch on. We have a powerful tools for caregivers workshop. So like I mentioned, caregiver burnout is so prevalent. We do acknowledge that, and we do have a 6-week workshop for that as well. It is an hour and a half once a week for 6 weeks, and we provide a resource for this one as well. So you can see it's quite a thick book there. It goes into mindfulness techniques. It goes into resources available for you if you're caregiving for someone with a chronic health condition. And we also provide local resources that are available within Brampton and the other areas we serve to give to our workshop participants, because we want to help them as much as possible. Oh, did we lose? Not sure what happened there. There we go. Yeah, so this one is a good one as well. Smaller group size again, really it reinforces the support, and anything that's mentioned within these workshops is held confidential in that as well, because we understand that there are different emotions that come with these types of topics. We also, this one, we're still kind of in the works of developing the back end of the program, but in 2020 we'll see more of it. It's our Mindful Awareness Stabilization Training Workshop. This one's only 4 weeks, 2 hours per week. And just a little fun fact I like to throw in, this was actually funded by Bell Let's Talk. So basically, with all the text, tweets, whatever people do to donate 5 cents on Bell Let's Talk Day, from that they've actually given a lump sum of money to St. Mike's Hospital, and they developed this program. And it's all Canadian resources. So it's kind of nice to see that the dollars are being used to something that is quite useful in the community. And again, we'll see more of this into 2020. And then we also have Getting the Most from Your Healthcare Appointment. It's a 1-hour workshop we offer on action planning on what to do before, during, or after your healthcare visit. I think anyone can benefit from that, because a lot of people feel like they don't have their questions answered or don't have enough time with their healthcare provider. We want to make sure we can help with that, and really, like the like the title of the presentation says, get the most from your healthcare appointment, because again, we also have priorities in our own lives as well, but at the end of the day, we are our best healthcare provider for ourselves too. So we do have another side. I'm just going to briefly talk about it. We have the community side. We also provide professional development opportunities for health service providers so that they can support patients or clients on their change journey to live a better, more healthy life. They're all listed up there. So we have treating patients with care. We have a workshop focused in empathy and how to really speak to patients and be supportive on their journey. Choices and changes, motivating healthy behavior. We have one in brief action planning. We also do a motivational interviewing series, and into the new year, we're actually going to be offering a workshop in health literacy, which is exciting for us because I think it's something that's very important as well. So that's all the programs we have to offer. I know there was quite a lot of information. If anyone has any questions, I'm happy to answer them now, or you can come see me at the table. I have cards and handouts with a bit more information on all of our programs. Any questions right now, or? No? Okay, well, thank you for your time.
Before we move ahead and have a very exciting exercise training program by Masab, I would like to thank our team who have made this event very successful. We have here UIC President Mr. Hamid Akbar Saab. Thank you very much. Imran Admi Saab, Vice President. Thank you very much. Muhammad Javed, our Secretary, is here. Thank you, Javed Bhai. Zaki Bhai is here. Mahmood Hayat. Anis Ahmed Saab, Treasurer, is here. Thank you very much, Anis Bhai. Rashid Bhai is here. Ashwaq Saab, yes, thank you. Rubina Zulfiqar, our UIC She President. Imran Ali. सामा सिस्टर समीना रियाज आप सब हजरात का बहुत बहुत शुक्रिया रियाज भाई इना और सलमान साहब फॉर कमिंग हियर थैंक यू वेरी मच thank you very much. Now I would like to request Masaf Zulfiqar. He's trained physiotherapist and he will teach you how to do home exercises to reduce diabetes. Ladies and gentlemen, Masaf Zulfiqar.
All right, I won't take up too much time, 5 to 10 minutes max. Exercise, we already know is super important. If I offered everyone here, if I just said 30 minutes every single day, you do some kind of movement. Just 30 minutes every single day, you do some kind of movement, right? If I told you, if you do that, I'll give you $10 million. I don't think anyone would refuse that. There's something that's even more valuable than $100 million if you had the chance, if you're on your deathbed. And I can't understand how people can let this go. If you're sick, if you have an opportunity to give up everything you have for just a few more years of life, you would probably do it, right? Exercise is the closest thing we have to a miracle cure or prevention type thing to actually achieve this without medication. And if you're on medication, that's fine. It helps with your medication. But it's the closest thing we have to prevent getting to that level in the first place. I read on the Canadian Therapy Association guidelines recently. This is astounding to me. According to the Canadian Physiotherapy Association guidelines and the 2013 Canadian Diabetes guidelines, poor physical fitness is equivalent to smoking as a risk factor for death. I want you to think about that. When you look at a cigarette package, what do you think of? You see lung disease. When you think of someone who is smoking or a loved one, you try your best to get them to stop smoking, right? Because you know what it's associated with. Poor physical fitness is equivalent to smoking. That's ridiculous. There's no excuse. 30 minutes every single day, as people have already talked about. There's no excuse. Really, there isn't. You start off small, as Ms. Shaista brought up earlier. You start off small. If you can't do 30 minutes, you do 10 minutes. If you can't do running, you do walking. You do something. I won't get into the specifics. I don't have enough time for that. We can talk later. But I will talk about two particular conditions. If you do have diabetes, how you exercise, and if you don't have diabetes, how we can prevent it. Because prevention is big too, right? It's said that with physical fitness, with following the guidelines, you can reduce the incidence of diabetes by 60%, 60%. Okay, so it's important, we know that. One thing in particular, it'd be very irresponsible of me to talk about exercise without highlighting some important things about diabetes. If you do have diabetes, okay, if you do have diabetes, please pay attention. If you do have diabetes and you want to exercise, I want you to take care of these few guidelines. Now, there's a particular condition associated with diabetes. It's called hypoglycemia, okay, low blood sugar. Now, exercise can help reduce the incidence of this, but at the same time, if you're if you start reckless and you do a lot of exercise or you're not careful with some of the guidelines that some of my colleagues before they brought up, then you can risk hypoglycemic shock. Don't be scared. I'll just give you some tips right now that can help to avoid this, okay? So number one, if you are on insulin medication, more than 1 hour before you start your exercise session, if you want to inject your insulin, try to do it more than 1 hour before your exercise session, okay? And that's very important. Number two, if you are injecting your insulin before an exercise session, try to do it not in an area that's going to be exercised. As an example, let's say you're doing shoulder press or any bicep curl or something involving the arms. Don't inject in your arms. Okay? Let's say you're doing squats or leg press or something involving the legs. Don't inject in the legs. Catch the drift? Okay? The safest way they say is to inject it inside your abdomen, your belly area. If you're doing crunches and ab exercises, then don't do that. Try to find an area that's not going to be worked out too much, okay? That's number one. Number two, try to find a consistent time every single day, preferably after a meal, but please try to avoid doing it before you go to sleep. I'll tell you why. It's important to try your best not to do it before you go to bed, okay? So the reason is, and again, don't get scared. I'm just giving you precautionary measures. If you have diabetes, I mentioned hypoglycemia. Ms. Shaista mentioned some of the symptoms associated with it. Now, the thing is, if you get into a hypoglycemic shock post-exercise and you go to sleep, the problem is some people can't recognize whether you're sleeping or you have a hypoglycemic shock. Does that make sense? It can be very dangerous. So that's the only reason. So try to avoid doing it before you go to sleep, but at the same time, try to do something every single day. Now, again, I'm going to keep this short, so I'm just going to get straight into some exercises we can do. For people that have diabetes, the best course of action is aerobic exercise, okay? Aerobic exercise, this is walking, running, any kind of cardiovascular activity. And the best type of aerobic exercise is exercise that involves large muscle groups, right? So our legs muscles in our legs are large muscle groups. Muscles in our back are large muscles groups, all right? So doing things like rowing is a good aerobic exercise. Doing things that involve your legs, like repetitive squats in an aerobic manner, that's a good form of exercise, okay? Aerobic exercise. Do that, however, avoid, you want to do that for 3 to 7 days a week. The intensity, that depends on your condition, right? Everyone's different. As was mentioned earlier, people that have diabetes, they have different conditions as well. It'd be very irresponsible of me to tell you what intensity to do it. You gotta see a health professional to that. See a physiotherapist. We can help design a program for you and we can help manage your other conditions as well. But try to make sure you do something every single day, okay? 20 to 60 minutes as was discussed earlier. Now, resistance exercise is also important, but I wanna highlight some things again to look out for. Now, I mentioned some things that are associated with diabetes, right? So one thing is peripheral neuropathy. So that was mentioned earlier. Now, that can affect your balance. So you should have a balance training program with your exercise program to prevent falls because that can cause more complications as well. If you are doing a resistance exercise, and you should do resistance exercise, and that can be weightlifting. Everyone thinks it's only weightlifting. It's also things like push-ups, guys. Even push-ups, even doing squats, that's resistance exercise. Any resistance, okay? If you are doing resistance exercise, for these measures, you really want to avoid doing heavy exercise. You want to avoid doing heavy upper body exercises. You want to avoid doing anything with your head down, okay? Reverse shoulder press, anything with your head down, avoid doing that. And anything that increases intra-abdominal pressure. So holding your breath and doing a squat, avoid doing that. And I'll tell you why. The reasons you don't want to do these 4 things if you have diabetes is because of the risk of, as was mentioned, diabetic neuropathy, okay? Diabetic retinopathy. That's damage to the retina in the eyes. That can be increased if you increase the pressure. Does that make sense? So avoid doing very heavy lifting. Okay, so we discussed diabetes. Now I also mentioned that if you have diabetes, yes, get a physiotherapist, get a physician, get someone to help you design a program. If you don't have diabetes, you can prevent it, guys. This is huge. People don't take this seriously enough. You can prevent it. Or at least delay it. If you're going to have it, you can at least delay it. Do something every single day. You can literally save your life. Thank you.
So, at the end, I would like to thank all of you for coming here. साबिर गाया साहब TV 360 से यहाँ पर तशरीफ़ लाए, मतीन साहब मिसागा से तशरीफ़ लाए, आप लोग असलम भाई, आसिफ गुमरा साहब हमारे एग्जीक्यूटिव काउंसिल हैं, और खालिद साहब प्लीज़ आप लोग का आने का बहुत बहुत शुक्रिया, जिनका मैं नाम नहीं ले पा रहा हूँ। जलाल साहब यहाँ बैठे हुए हैं, बहुत शुक्रिया, और आप सब हजरात का बहुत बहुत शुक्रिया। और अरशद भाई का पहले ही कर चुका हूँ, तो थोड़ा सा स्नैक्स का इंतज़ाम हमने किया है, और स्नैक्स के दौरान आप लोग को कोई भी सवाल जवाब हो तो आप ये दोनों टेबल पर रब्ता कर सकते हैं, और जो अप्रेंटिस ये लाएँ ये इसको डिस्प्ले भी करेंगे। तो प्लीज़ फील फ्री टू हैव स्नैक्स एंड आस्क क्वेश्चन एंड आंसर सेशन।
सलमान,
मैं अस्सलाम वालेकुम। एक मिनट आपका लेना चाहता हूँ मैं। वी आर हेयर फ्रॉम कैनेडियन एसोसिएशन ऑफ पाकिस्तानी फार्मासिस्ट। वी हैव टू सीनियर फार्मासिस्ट, बोथ वर्क फॉर शॉपर्स ड्रग मार्ट, हिना इरफान एंड मीर तबस्सुम। If you guys have any questions regarding अच्छा, तो आपके पास जो भी सवाल हो आपकी दवाओं के हवाले से ख़ास तौर पर, तो हम हाजिर हैं आपके लिए। 2-3 बातें मैं आपको बताना चाहता हूँ यहाँ पे। देखिए, नवंबर का जो महीना है वो ग्लोबली डायबिटीज़ अवेयरनेस का महीना है थ्रू दी यूनाइटेड नेशन। So diabetes needs a lot of education and awareness, and I have the privilege to represent CAP here, and I just want to thank Unity in the community for giving us this opportunity. So please take the advantage of experts and come up with your questions, and we are here to answer that. Thank you so much.
अस्सलाम वालेकुम, मेरा नाम है मोहम्मद जावेद और आज हम फिर एक बार अपना डायबिटिक्स सेमिनार जो हमने आज लेके आए थे ब्रैम्पटन फ्लेचर कम्युनिटी सेंटर में। यूआईसी जो है लास्ट ईयर भी हमने एक सेमिनार डायबिटिक्स के लिए अटेंड करवाया था यहाँ पर, और बहुत सारे लोगों ने यहाँ पर शिरकत भी करी। आज भी अल्हम्दुलिल्लाह काफ़ी लोग हमारे जो है ना हमारी कम्युनिटी के मेंबर्स आए, हमारे डॉक्टर्स हमारे क्या कहते हैं फार्मासिस्ट, हमारे CAPP के हमारे कुछ और भी हमारे एसोसिएशंस के आज जुड़े, और सबसे यही बात पता लगी कि जो डायबिटिक्स है वो एक ऐसी डिजीज़ है जो हमारे साउथ एशियन में बहुत तेज़ी से फैल रही है, और इसको क्योर करने के लिए हम सबको मेहनत करनी पड़ेगी, हम सबको अवेयरनेस जो है ना वो सब तक पहुंचानी पड़ेगी। और वो अवेयरनेस इसी तरह आ सकती है कि हम अपने ऐसे छोटे सेमिनार जो हैं वो हम लॉन्च करें, और ताकि लोगों को हमारी अपनी कम्युनिटी तक ये बात पहुंचे कि उनको कौन सी डाइट ऐसी जो है वो उनको यूज़ करनी चाहिए, कौन सी ऐसी एक्सरसाइज है जो उनको एवरी डे हमें कहते हैं करना है। तो अल्हम्दुलिल्लाह यूआईसी के हमारे सर्वे मेंबर्स ने आज जिस तरह मेहनत करके ये एक सेमिनार ऑर्गेनाइज़ किया, और आई रियली अप्रिशिएट मिस्टर ऑल द टीम ऑफ दिस ऑर्गेनाइजेशन हैव डन द ग्रेट जॉब टुडे। और मैं उम्मीद करता हूँ इसी तरह आप सब लोग जो आए आज उनका भी बहुत बहुत शुक्रिया, और वो इसी तरह हमारा साथ देते रहेंगे। यूआईसी ऑलवेज स्टैंड फॉर ऑल communities and for the education awareness. We always come forward again and again. So thank you very much again. Allah Hafiz.
जी, मेरा नाम फसी सैयद है, मैं यूनिटी इन द कम्युनिटी का प्रेसिडेंट हूँ, और आज मैं यहाँ आपको मुखातिब कर रहा हूँ। आज यूनिटी इन द कम्युनिटी ने एक डायबिटीज़ अवेयरनेस सेमिनार कराया। ये दूसरे साल हम लोग ये सेमिनार करा रहे हैं, और माशाल्लाह से बड़ा सक्सेसफुल सेमिनार रहा है, और इसकी कवरेज जो है टोरंटो 360 पे, और साबिर गाया साहब भी आपको दिखाएंगे जो एक प्रूफ है, एविडेंस है हाउ सक्सेसफुल इट वाज। माशाल्लाह से 150 से 200 लोग यहाँ पे मौजूद थे, जिन्होंने बड़े अच्छे जो विलियम ओस्लर हॉस्पिटल से जो एजुकेटर्स आए थे उनको सुना और उससे मुस्तफ़ीज़ हुए। तो यूनिटी इन द कम्युनिटी हमेशा कोशिश ये कर रही होती है कि वो कम्युनिटी सर्विस बेस्ड प्रोग्राम लाएँ और आपकी खिदमत के लिए। इस सिलसिले में हमारा ये प्रोग्राम अभी ख़त्म हुआ है, अब इंशाल्लाह ताला बहुत जल्द हम लोग दूसरे प्रोग्राम लेके आएंगे। तो मैं इस मौके पर टोरंटो 360 टीवी का, अरशद भट्टी साहब का, साबिर गाया साहब का शुक्रिया अदा करता हूँ कि उन्होंने बहुत खूबसूरत कवरेज यहाँ पे आके की। थैंक यू वेरी मच, सो काइंड ऑफ यू।
नाज़रीन, आपने देखा इस वक्त यहाँ पर ब्रैम्पटन में यूनिटी इन द कम्युनिटी जो ऑर्गेनाइजेशन है, उन्होंने यहाँ पर डायबिटीज़ के हवाले से एक इन्फॉर्मेशन सेमिनार अरेंज किया था और यहाँ पे काफ़ी तादाद में लोग आए, यहाँ पर सवाल जवाब भी हुए और हॉस्पिटल्स के नुमाइंदे भी यहाँ पर मौजूद थे, कुछ प्रैक्टिशंस भी मौजूद थे जिन्होंने आवाम को यहाँ पे आगाह किया और ख़ास तौर पे साउथ एशियन कम्युनिटी के अंदर डायबिटीज़ का जो मर्ज़ है वो अमूमी तौर पे जो है वो पाया जाता है, लेकिन इस हवाले से इनकी कोशिश थी कि लोगों को इस हवाले से बताया जाए कि किस तरह से प्रिवेंट किया जा सकता है और जिनको जो डायबिटिक हैं वो किस तरह से अपनी ज़िंदगी में बैलेंस को लेके आएँ, क्योंकि डायबिटीज़ जो है वो न सिर्फ एक मर्ज़ का नाम है बल्कि ये बहुत सारे अमराज की तरफ जो है वो इंसान को लेकर के चला जाता है। तो यूनिटी इन द कम्युनिटी की एफ़र्ट जो है वो इस हवाले से अच्छी रही और गाहे बगाहे ये जो है वो कम्युनिटी के अंदर ऐसे सेमिनार्स करते रहते हैं कि जहाँ पे लोगों को इन बीमारियों से या दीगर और ऐसे मामलात से जिनसे जो है वो आगाह किया जाए ताकि वो अपनी ज़िंदगी को मज़ीद बेहतर बना सकें। कैमरामैन साबिर गाय साहब के साथ उवैस इकबाल फ्रॉम टोरंटो 360 टीवी। आप लोगों के देखने का बहुत शुक्रिया। अस्सलाम वालेकुम। हाँ जी, एक्स्ट्रा हो गया साबिर भाई, एक्स्ट्रा हो गया। नाज़रीन अस्सलाम वालेकुम, बहुत बहुत शुक्रिया आपका टोरंटो 360 टीवी देखने का। यहाँ पे ब्रैम्पटन में एक मकामी कम्युनिटी सेंटर में यूनिटी इन द कम्युनिटी की जानिब से आज डायबिटीज़ के हवाले से इंफॉर्मेशन अवेयरनेस सेमिनार रखा गया है, जहाँ पे मुतवक्के है कि जो है वो काफ़ी तादाद में यहाँ पर लोग आएंगे और इस मर्ज़ के हवाले से जो है वो उनको आगाही दी जाएगी और किस तरह से जो है वो अपने आप को वो इस मर्ज़ से बचा सकते हैं या अगर डायबिटिक पेशेंट वो हैं तो किस तरह से वो बैलेंस लाइफ गुजार सकते हैं। साउथ एशियन कम्युनिटी में यानी इंडिया, पाकिस्तान, बांग्लादेश, दीगर मुल्कों के रहने वालों के दरमियान जो है वो लोगों में अमूमी तौर पे ये मर्ज़ पाया जाता है और बाज़ औक़ात तो अब देखने में आता है कि बड़ी अर्ली एज से ही लोग जो है वो डायबिटिक पेशेंट बन जाते हैं। आपके लिए, मेरे लिए ज़रूरी है कि हम अपने आप को अवेयर करते रहें एटलीस्ट कि कौन सी ऐसी ग़िज़ाई अशियाँ हैं जो हमें खानी चाहिए, जो नहीं खानी चाहिए और किस तरह से हम अपनी ज़िंदगी के अंदर बैलेंस लेके आएँ ताकि हम ऐसे अमराज से बच सकें। और जैसा आपके इल्म में भी है कि डायबिटीज़ एक ऐसा मर्ज़ है जो इटसेल्फ एक मर्ज़ ही नहीं बल्कि ये बहुत सारे अमराज की तरफ आपको धकेल देता है और ज़िंदगी जो है वो बड़ी अजीरन होना शुरू हो जाती है। तो यूनिटी इन द कम्युनिटी, फसी सैयद साहब, जावेद मोहम्मद जावेद साहब, दीगर इनके और जो साथी इनकी टीम, उनका भी हम शुक्रिया अदा करते हैं कि उन्होंने ऐसे जो है वो मौक़े आवाम को फ़राहम किए हैं, ख़ास तौर पर साउथ एशियन कम्युनिटी के अंदर, ताकि वो अपने आप को, अपनी ज़िंदगी को बैलेंस बना सकें और इस पैगाम को दूसरों तक पहुँचा सकें। यहाँ पर जो है वो मुख्तलिफ़ हॉस्पिटल्स के रिप्रेजेंटेटिव भी मौजूद हैं और जो फार्मेसी एसोसिएशन है उसके भी नुमाइंदे मौजूद हैं। यहाँ पर लोगों को बताया भी जाएगा, ये नुमाइंदे जो ऑफिशल्स हैं, जो इस फील्ड के एक्सपर्ट हैं, वो लोगों से बात करेंगे और लोगों के सवालों के जवाबात देंगे। आप तक हम वो कैरी करेंगे और जो है वो इस इंफॉर्मेशन से उम्मीद है कि वो हमारे नाजरीन जो इस रूम में मौजूद नहीं हैं वो वर्चुअली टीवी के ज़रिए और फेसबुक के ज़रिए इस इंफॉर्मेशन से मुस्तफ़ीद हो सकेंगे। आप लोगों के देखने का बहुत बहुत शुक्रिया।
Canadian Association of Pakistani Pharmacists. Hello, testing 1 2 3. Hello, testing 1 2 3. चलो आ जाओ साबिर भाई ना आ जाओ ये खोल दें दरमियान से
इसने एक्स्ट्रा कर दिया लेकिन तुम कर लो
चलो देख लेते हैं आप देख लेना ना कम्युनिटी के ज़ेर एहतमाम आज ब्रैम्पटन में डायबिटीज़ शुगर से आगाही के हवाले से एक सेमिनार का इनेकाद किया गया था जिसमें यहाँ पे उस हवाले से कि क्या वजूहात हो सकती हैं शुगर की, किस तरह से इसका बचाया जा सकता है, किस तरह आप अपने आप को बेहतर ज़िंदगी गुजार सकते हैं और उसके साथ साथ कुछ एक्सरसाइज के हवाले से भी बात की गई। यूनिटी इन द कम्युनिटी बहुत अच्छे प्रोग्राम्स हम देख रहे हैं कि कम्युनिटी के हवाले से कर रही है और डायबिटीज़ एक ऐसा मर्ज़ है साउथ एशियन में बहुत ज़्यादा जो है आप कह लीजिए कि ओवर 40-45 अक्सर लोगों को डायबिटीज़ हो जाती है और इसमें अगर आप अपनी ज़िंदगी का तरीक़ेकार अगर कहते हैं कि लाइफस्टाइल अगर बदल लेते हैं तो आसानी से जो है आप ज़िंदगी गुजार सकते हैं, वगरना इसके बहुत सी कॉम्प्लिकेशन हो सकती हैं जिसमें हार्ट, किडनी और बहुत से प्रॉब्लम्स आ सकते हैं। बड़ा इंपॉर्टेंट है, नवंबर का महीना जो है वैसे भी ज़ियाबीतिस से आगाही का महीने के तौर पे देखा जाता है और इस हवाले से जो लोग इसमें मुब्तला हैं उनको परेशान तो नहीं होना चाहिए लेकिन एहतियात बहुत ज़रूरी है और ख़ास तौर पे आप इसमें अपने खाने पीने के ज़रिए जो है एहतियात के साथ जो है वो आप जो है अपने आप को बेहतर तौर पर जो है वो ज़िंदगी गुजार सकते हैं। यहाँ पे मुख्तलिफ़ जो एसोसिएशंस हैं वो भी मौजूद थी, उनके स्टॉल मौजूद थे। CAPP का स्टॉल था और बाकी जो हैं गवर्नमेंट के स्टॉल्स मौजूद थे, गवर्नमेंट फंडेड जो एजेंसीज़ हैं उनके स्टॉल से कि किस तरीके से आप जो हैं गवर्नमेंट इस हवाले से जो है आपको मुकम्मल रहनुमाई भी फराहम करती है, उनकी वर्कशॉप्स भी होती हैं, उनके मुख्तलिफ प्रोग्राम्स होते हैं जिसमें आप हिस्सा लेकर आप बेहतर तौर पर इसको समझ भी सकते हैं। डायबिटीज़ या शुगर जो है ये साउथ एशियन में बहुत ज़्यादा आम है, तो इसके लिए कोशिश करनी चाहिए कि इसका आप इल्म भी हासिल करें, आगाही भी लें और अपनी ज़िंदगी को इस तरह से गुजारें। कैमरामैन साबिर गाह के साथ अरशद भट्टी को दीजिए इजाज़त। अल्लाह हाफिज़ और सपुर्द मौला।
One moment, ma'am. Can I introduce myself? अस्सलाम वालेकुम, मेरा नाम हिना अशरफ है और मैं जो हूँ वो एक लाइसेंस फार्मासिस्ट हूँ और इसके साथ ये मेरे साथ जो खड़े हुए ये मेरे कैप ऑर्गेनाइजर्स भी हैं इधर, जो कि कैनेडियन एसोसिएशन ऑफ पाकिस्तानी फार्मासिस्ट हैं हम सारे। तो चूँकि ये एक डायबिटीज़ अवेयरनेस मंथ है तो उसके अंदर मैं आप लोगों को कुछ टिप्स दूंगी कि किस तरह अपनी डायबिटीज़ को कंट्रोल की जाए। और डायबिटीज़ जो है वो बहुत ही कॉमन एक ऐसी डिज़ीज़ हो गई है जिसमें आप लोगों को परेशान ना हो, उसमें आप कंट्रोल कर सकते हैं। अगर आप का शुगर लेवल आया है ब्लड वर्क में कि आप जो है बॉर्डर लाइन हाई है तो वो आप उसको डाइट एंड एक्सरसाइज से कंट्रोल कर सकते हैं। और 150 मिनट्स पर वीक की एक्सरसाइज आपको करनी है और डाइट को आपको कंट्रोल करना है। फिर आप 3 मंथ्स के लिए डॉक्टर के पास 3 मंथ्स के बाद इस ट्रायल के बाद जाएं डाइट एंड एक्सरसाइज के, डॉक्टर से कहें कि आपका शुगर लेवल फिर चेक करें। अगर शुगर लेवल आपका फिर नॉर्मल नहीं आता है तो फिर डॉक्टर आपको फर्स्ट लाइन ऑफ ट्रीटमेंट दे सकता है मेडिकेशन के तौर पे, कि जो कि आप वो ले सकते हैं। और जब भी मेडिकेशन स्टार्ट करें तो अपने फार्मासिस्ट से ज़रूर बात करें कि हाउ टू मैनेज द साइड इफ़ेक्ट्स। बाज़ दफ़ा ऐसा होता है कि आप मेडिकेशन स्टार्ट करते हैं और आप साइड इफ़ेक्ट्स की वजह से अपनी मेडिकेशंस को क्विट करना चाहते हैं, तो नहीं, ये बिल्कुल मत कीजिए। आप अपनी मेडिकेशंस को लीजिए और फार्मासिस्ट से बात कीजिए कि इसको किस तरह लेना है और किस तरह, और उसके साथ साथ आपको ग्लूकोमीटर मशीन आती है जो आपके शुगर लेवल को चेक करती है, जो कि आपको सुबह फास्टिंग करनी है और 2 आवर्स आफ्टर फूड करनी है। उसमें आपको अंदाज़ा होगा कि आपकी मेडिकेशंस आपके सिस्टम पे कितना असर कर रही है, और अगर फ़र्ज़ कीजिए आपकी मेडिकेशंस नहीं, आपका शुगर लेवल कंट्रोल हो रहा है, तो आप फिर डॉक्टर के पास जाइए, फिर उससे ब्लड वर्क एवरी 3 मंथ्स इज़ रिकमेंडेड फॉर पीपल हु आर रिसेंटली डायग्नोज्ड विद डायबिटीज़ एंड दे आर ऑन मेड्स। सो दे विल ट्राई सेकंड सेट ऑफ मेडिकेशन। उसमें ये कि फिर आप सेकंड ट्राई करें, फिर दोबारा जाएं और देखें कि इंशाल्लाह वन टाइम ऐसा आएगा कि आपका शुगर लेवल कंट्रोल होगा थ्रू डाइट एंड एक्सरसाइज, एंड इफ़ नॉट देन विद द हेल्प ऑफ मेडिकेशंस। थैंक यू।